Good afternoon, everyone, and welcome. It's 3 p.m., and I think we will start. We have quite a number of participants who have joined us. So I'd like to just, on behalf of the College of Physicians and Surgeons of BC and the Ministry of Health, um, welcome you to this webinar today. Before we begin, I would like to acknowledge that the College of Physicians and Surgeons of BC is located on the unceded territory of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. Before we begin, I'd like to introduce our team here at the college that's responsible for the diagnostic accreditation program, and specifically will be responsible for the DAP accreditation of HSAT facilities. So to begin with, we have Jonathan Agnew, and he is our director of our accreditations program. And then there is Sharon Manship, and Sharon is the manager of our diagnostic services portion of the accreditation program, and Nav Rakra, and he is our accreditation research and development officer for diagnostic services. And I'm Dr. Michael Murray. I'm the deputy registrar of the college, responsible for the accreditation programs and responsible for this component of it as well. What I would ask of everyone, if you have questions that surface during this presentation, that I ask you to use the chat function on the bottom of your screen and just type in the question that you have for us. And at the end of the presentation, what I will do is I'll go through all of the questions that you've asked of us today and answer those until our time is finished. And any questions that we cannot get to during this webinar, we will post online at the college website for you to see the answers to those questions. After the webinar, if you have any questions of us, you can get in touch with us through the email that's listed on this slide, dap@cpsbc.ca, and then specific questions and access to the site where we will have the questions, and this presentation is the website that's listed at the very bottom of this slide. I will now turn it over to Jonathan Agnew, and he'll go over what we're going to talk about with you here today, and then start us off. So thank you, Jonathan, and go ahead.
Thank you. Good afternoon. It's a pleasure to present to all of you virtually today. As Dr. Murray mentioned, I'm Dr. Jonathan Agnew, Director of the college's accreditation programs, which includes the Diagnostic Accreditation Program, or DAP, which is where home sleep apnea testing accreditation will be managed. The overview of this presentation, you can see we have a number of topics to cover, and then time for questions and answers. I will be giving the overview of the Diagnostic Accreditation Program and share with you what we do, who we are, and how we go about doing accreditations. And that'll be followed by my colleagues who will discuss the specifics of the HSAT accreditation process, standards development, the roles and responsibilities of medical directors, and then we'll conclude with the questions. Next slide. So the Diagnostic Accreditation Program is one of two accreditation programs at the college. Both of them have as their function accreditation of facilities in British Columbia. Let's start with the most basic, which is the definition of accreditation. It is essential to the provision of quality in healthcare because it benefits everyone, regulators, patients, healthcare providers, because under a system of accreditation, all of them can expect consistent, high quality care. They can anticipate reliable outcomes that patients can trust, and everyone's confident that the services provided will meet expectations. The job of the DAP is to assess and accredit diagnostic services facilities across all of British Columbia. That means that all diagnostic services, public and private, must be accredited by the DAP to operate in the province. As you know, there are many health professional colleges in the province, and in British Columbia, the Health Professions Act gives the College of Physicians and Surgeons responsibility for providing a diagnostic accreditation program. It's in section 25.51E of the Health Professions Act that specifically empowers our college to run the DAP. It's a short sentence with a big impact, and it states very simply that the college is providing for a diagnostic facilities accreditation program. The how of getting that work done is in the college bylaws, which describe the composition and role of the DAP committee. They oversee all of our work. And it also gives specifics about accreditation, the role of the medical director, and quote, inspections, or what we now call assessments. Here's a snapshot of our activity. In the 2019-2020 fiscal year, the DAP ran and continues to offer 24 unique accreditations covering diagnostic imaging, laboratory medicine, neurodiagnostic services, pulmonary function, and polysomnography. HSAT will be number 25, the newest addition to the list. You could see there on the right-hand column of this slide some of the numbers to give an idea of the scale of our work. We accredit 400 private diagnostic facilities in British Columbia, not yet counting HSAT or CPAP, 293 public diagnostic services. And to get to those accreditations, last year we did 188 on-site surveys. 26 of those were initial assessments, that is new facilities that had opened in the province. 9 of them were facilities that had relocated, which we also assess. If you add in the number of facilities that we accredit, the number of physicians and healthcare providers and professionals associated with them, and the total number of services and patients that are offered, our group regulates a system the size of some entire provincial healthcare systems. It's not a small operation, but we like to think it's a good one. Next slide. Here's how we're organized. I know the slide is a little small for you to see the names, but at the top here is the DAP leadership team, headed by Dr. Murray, who you saw at the beginning of the presentation, then myself as the director, and I'm supported by 3 managers, Sharon Manship, Debbie Penn, who is our quality systems manager, and Colin Carey, who manages laboratory services. It's actually under Sharon Manship, who's responsible for diagnostic services, whose group will be responsible for running the HSAT accreditation. So how do we actually go about assessing facilities? All of the facilities are assessed to DAP standards. Those standards are evidence-based, and they cover medical, technical, and management aspects of services. We align them explicitly with the principles of continuous quality improvement. In other words, to support facilities in identifying opportunities for improvement and regularly engaging in improvement activities. Facilities are assessed on a 4-year cycle, and on-site assessments are conducted by teams of physicians and technologists with specific expertise in the areas being assessed. In contrast, the act of actually giving the accreditation to a facility that has been assessed rests with the DAP committee. The DAP committee accredits facilities based on the results of the assessment. It's appointed by the board of the College of Physicians and Surgeons, and it includes physicians who are registrants of the college, public representatives, and other technical experts. And they're responsible for overseeing all of the work they do. That's the highest level overview. I will now pass it over to Sharon Manship, who will go into some greater detail. Sharon.
Thank you, Jonathan. Good afternoon, everyone. So I'm now going to go and explain how the accreditation process will work for the HSAT facilities that are currently providing testing. So there are 5 main steps that a facility must complete to become fully accredited with a diagnostic accreditation program. So that's enrollment, initial assessment application with attestation, a provisional accreditation, an initial accreditation assessment, and a full on-site accreditation assessment. This slide shows the timelines associated with each step. So HSAT enrollment is ongoing, and that will close on September the 30th of 2020. Initial assessment application will begin in January of 2021, and all enrolled facilities will apply by February of 2021. The initial assessments, which will be performed by a desktop audit, will be scheduled within 2 years of the initial assessment application. And then a full on-site assessment will be scheduled 1 to 3 years post initial assessment. And you can see at the bottom, the provisional accreditation will be awarded to facilities after the attestation. There are 2 additional steps in the accreditation process for starting this new program. Both were added to ensure that facilities currently providing home sleep apnea testing do not experience a pause in service during this time. The first is enrollment. This is a very important step. It allows facilities to continue uninterrupted services based on their current practices. It informs the DAP of the scope of the program and allows us to plan accordingly. There is no cost to the facilities for enrollment, and you are not obligated to apply for accreditation if you do not wish to continue the services after this point. Sorry, I may have made the break there. You do not need to fill out all of the information to enroll. For example, if you do not have a confirmed medical director yet, you can leave the field blank. What we do need is the facility name, an address, and the primary contact information for the facility. The next step is the initial assessment application and attestation. Enrolled facilities will be the first to apply for an initial assessment. And part of that application will involve submitting a signed attestation to a subset of safety standards, about 10 to 12. Once this attestation that says you have met these standards, this attestation is the second additional step to the process. And so facilities with assigned attestations will be awarded a provisional accreditation as approved by the DAP committee. Any new facilities or facilities that are not enrolled with the DAP would not be able to do this process. They would have to apply for an initial assessment and could not start seeing patients until after they complete the assessment and achieve a provisional accreditation. So as I mentioned, the provisional accreditation award will be given after the attestation. At this point, facilities will be added to the accredited facilities list on the DAP webpage. And this is where the annual fees will start. The next step is the initial accreditation assessment. And as I mentioned earlier, this will be done by a desktop audit and scheduled within 2 years of the application. There will be an evidence request sent out to the facilities, and they will have to send in that evidence to show that they meet the subset of standards for the initial assessment. And again, these will be related to the quality and safety standards only. The evidence is reviewed by the DAP staff, and if satisfactory, the provisional accreditation award will be confirmed by the DAP committee. A full on-site accreditation assessment is required in order to meet full accreditation, and this will be scheduled for the facilities 1 to 3 years post-initial assessment. This will involve a DAP assessor completing an assessment with the facility staff at the facility's location, and they will be assessed to the full set of HSAT accreditation standards. After this assessment is complete, the facility will be provided with an accreditation report, and on that report will be any non-conformances that have been identified during the assessment. A full accreditation award will be awarded to the facility once all of the non-conformances have been addressed, again through the DAP committee. The DAP will be providing additional support to the HSAT facilities as we move forward. We already have an HSAT web page on the college website, which you can see the link here. And that is just basic right now, but as we add different documents and standards. They will be all posted on that webpage. The DAP will be offering a planning session, a remote planning session with the facilities prior to any assessments. We have a dedicated accreditation specialist who will be we're providing you with the contact information, and they're dedicated to the HSAT program. And we also have additional supporting documents that will become available as they are developed. Thank you.
So thank you, Sharon. So the topic that I'd like to share with you today is about the DAP accreditation standards for home sleep apnea testing. So in general, accreditation standards are the foundation of our assessments. They represent the level of performance required to achieve accreditation with the college. The principles for developing accreditation standards requires a scaled balance of having enough rigor in the content to ensure that the quality and safety measures are in place to safeguard patients, while at the same time ensuring that there is enough flexibility to be applicable across different facilities, because we do understand and appreciate that operations vary from one facility to the next. Although there is a complex process on how accreditation standards are developed, this is a good high-level diagram illustrating the steps for standards development. The primary steps always include a R&D component where the landscape of the topic, or in this case, the new program for home sleep apnea testing, is evaluated. This is done through many different mechanisms, some of which include literature review, consultation with subject matter experts, and engaging with facilities. The next steps includes a formal consultation with subject matter experts. The purpose of this step is to understand the content that will be required for the standards. The end goal of this step is to have a draft set of accreditation standards. The next step of community feedback is where we currently are, and I believe is the most important part of the process of developing accreditation standards. The goal of this step is to correlate the feedback, review all the feedback, and revise accreditation standards if required. As mentioned earlier, and as a reminder, it is extremely vital that we receive your feedback. Feedback is due by the end of this month on the 30th of September. I strongly encourage all members to submit their feedback. We do have a specific process for anyone to submit their feedback via the online feedback portal. Details on this process have been forwarded to everyone by email. I want to emphasize that submitting your feedback via the online feedback tool is the best way to ensure that your feedback is captured and will be evaluated. Further, as guidance, your feedback submission should include 3 elements. 1 is the rationale for disagreement. 2 is the recommendation for the desired outcome or amendment. 3 is evidence to support your feedback or literature review. Lastly, I do want to emphasize once again that your feedback is extremely important, and each piece of feedback is sincerely evaluated by both our team at the DAP and by subject matter experts. So please do send in your feedback through the online feedback portal. The final step in the development process is for the DAP committee to review and approve the final draft of the accreditation standards. It is our plan and hope that to have a published version of the accreditation standards by the end of this year. Finally, the accreditation standards are the foundation of our accreditation programs, and we commit to a continuous improvement model through a systematic review process to ensure that the standards reflect current best practices. The way the standards are presented are basically made up of 3 basic components. The first component is the standard. It is identified by ending with a point O. And you can see in the example below, it's with the first arrow, HG 3.0. It basically represents an overarching goal statement. Below that is the second component, which is defined as the criterion. It is identified by the ending of point 1, point 2, etc., and it represents a specific activity of a standard. Below that, the last or third component of the standards format is basically defined as the descriptors. They represent the specific actions for each criterion. Basically, it is this section that are the meat and potatoes of the accreditation standards. These descriptors are either best practice or mandatory. Mandatory descriptors are those actions that must be implemented by a facility, and they are identified by a capital bold M. As Sharon mentioned earlier, much of the information that individuals or facilities are seeking can be found on the college website. HSAT will have its own webpage under the college website. The college website can be found at www.cpsbc.ca. From the college homepage, there's a Programs tab located at the top, which is circled in red. Under the Programs tab, there's a link to the Diagnostic Accreditation Program. Under this tab, you will find details for all the accreditation programs, including home sleep apnea testing, and you can see this on the left side of the screen. It is here that you will find additional details and resources such as how to enroll for accreditation and published accreditation standards. Next.
I'll just take a moment to review with you at a very high level the roles and responsibility of the medical leaders. In the standards, it goes into much more detail around the roles and responsibility of the medical leader for your HSAT facilities. But essentially, one of the key roles of the medical leader is that they're responsible to ensure that there's compliance with all the bylaws of the College of Physicians and Surgeons of BC. It is through that mechanism that we hold them personally accountable for the facilities in which they are the medical director. And it's also through accreditation that we hold the facilities accountable to the standards and our ability to accredit and suspend or revoke accreditation over a period of time. But it is important that each facility have a designated medical leader. The medical leader is also responsible for the professional performance of the medical staff. So any person that's interpreting the home sleep apnea testing done at a particular site, the medical leader is responsible for credentialing and privileging them and for ensuring the quality of those services. The medical director is also responsible for the overall quality of the services provided within the facility itself. Now, although the standards are quite clear in terms of the responsibility of the medical leader, and we do hold the medical leader accountable for all these roles and responsibilities, the medical leader can delegate them to other individuals within your organization. And that could be an RT within your organization or some other person. However, the medical director still retains the responsibility for those roles and responsibilities that they have. So that some of the questions we get is, how much effort is it going to take for the medical director to actually assume these roles in our facilities? And the answer to that is, historically, when we look at, say, even level 1 facilities, or if we look at similar types of facilities to your facilities, and that would be community-based neurodiagnostic facilities, the amount of time that medical director needs to spend in fulfilling those roles can be quite limited. And that depends upon the resources of your organization and the capabilities of individuals in your organization to actually take on some of these responsibilities of the medical leader. And then the medical leader just simply provides the oversight and is the official signatory to attesting to these standards and ensuring that they are met. In terms of the medical director and any legal liability, the medical leaders of our facilities in general, if they are making decisions that are clinical care decisions about patients, they have coverage through the Canadian Medical Protective Association for issues that may arise out of making clinical-based decisions. Some of those clinical-based decisions may be the appropriateness of testing or not testing an individual. They may be around interpretation of tests themselves. And the CMP typically covers those types of, that type of work of the medical director and the liabilities associated with it. What the CMPA does not cover is other aspects of the medical leader work. So certainly if the medical director or medical leader takes a role in the hiring of firing of other staff, then indeed, if there's a action taken against the medical director for non-medical issues, such as administrative issues like that, then the organization has to have their own insurance should an employee launch any action against the medical director of that facility that falls outside of clinical and medical care. And I'm going to ask Sharon just to give you a summary of the next steps, and we'll come back and answer some questions.
Thank you, Michael. So yeah, so what's next? So the enrollment closes on September the 30th. So we will have a full list of all of the facilities that have enrolled with us, and those will be the facilities that can continue uninterrupted service. We'll then be contacting these facilities about the next steps before January of 2021. So that's when the next steps will start. We will then be accepting the initial assessment applications and with the attestation document attached. And then the HSAT facilities will be provided with a provisional accreditation as approved by the DAP committee, and they will join the list of accredited facilities on the DA website starting in February 2021.
All right. Well, thanks very much for that presentation. And what I'd like to do now is entertain questions that you have. But before we begin the questions, I'd just like to introduce Woody Turnquist from the Ministry of Health, who has joined our team on the panel today. Unfortunately, he's had some problems in terms of his video, but he's able to speak as well. So what I'll do is I will attempt to answer the questions as we go forward. And if there are some questions that I need one of the DAP staff members to respond to, or Woody to respond to, I would call on each one of those individually. So welcome, Woody, to today's presentation. Okay.
Thank you. Happy to be here.
As we go along, if you have additional questions, just add them to the chat. And as I said, we'll go through them. I have about half an hour to get through as many as we can, and those that we do not get through, we are committed to post them on our website. So here we go. The first question was, since HSAT services are provided as an outpatient service, why are accreditation standards more similar to a level 1 inpatient service instead of outpatient services such as outpatient spirometry? Good question. And it has a number of elements to answering it. The first is that the standards for testing for overnight sleep apnea testing would be no different whether they're provided by yourselves on an outpatient basis or provided by a level 1 facility in a outpatient basis either. And in fact, the DAP does have standards for home sleep apnea testing for level 1 facilities. And those same clinical standards are the same that would be applied to your HSAT facilities. I think the second piece of this question comes around a lot of the other elements, such as the management standards for facilities providing HSAT services. And what I can say is that the level 1 inpatient services are extremely much more complex in terms of all the other standards, the management standards, than are the HSAT services that we are accrediting at your facilities. And in fact, the standards are probably more akin to some of the outpatient service standards like neurodiagnostic imaging. Certainly, outpatient spirometry is far less complex than your HSAT facilities and the testing that you are doing. And so the standards that we use for outpatient spirometry is very different. Certainly, inpatient spirometry level 1 or even community-based level 1 spirometry that is there is quite comprehensive as well. So that we feel that there's a good balance that have been brought to the HSAT standards for your facilities compared to what we would expect for our level 1 inpatient polysomnography, and are more similar to something like neurodiagnostic outpatient community-based facilities that we also accredit. The next question that was asked, and there's actually several that are very similar to this, so I'll try and answer them all with this question. And the question is, do we enroll each location or just each company with multiple facilities or locations? Again, an excellent question. In the diagnostic accreditation program, we accredit each site individually that is at a separate address. And therefore, what we need is we need information about each location, because each location is accredited as a new site. So yes, each company, even though you may have multiple locations, will need to enroll each individual location. Now, you can send them all to us together if you choose, and we do recognize that perhaps it will be the same contact person for each of those locations, but we do need you to fill out an enrollment on each location within your company, and it'd also be helpful to specify on that enrollment the company that is the primary company, so we can actually link this data set together. Now, having said that, certainly when we do our assessments, there is ability to do some joint assessments, so that if you're a company that has multiple facilities, you have a common set of management policies and procedures, or medical policies and procedures, we can often group those together and look at those management standards as one grouping that's applied to each of the facilities. And that does save time for the multiple sites. The next question is, how much are the annual accreditation fees for HSAT? And I think there was another question that was the same. The annual fees for accreditation is $2,000 per facility or per specific address that is being accredited. And that fee also covers off the assessments that we do, whether it's the desktop assessment initially, or in the future when we go in actually do the on-site assessments. So those accreditation fees that are paid annually cover all of that off. The next question, what are the qualifications of individuals on the committee that conduct the accreditation comprised of? Okay, the qualifications. There's some aspects of this question that are joining our accreditation assessment team with the committee, which are two different groups and two different distinct functions. So when we look at the accreditation assessment, whether it's the desktop assessment or we go onto your site to do an assessment, that's usually subject matter experts that comprise that team. So if required, we will have a physician who is part of that accreditation assessment team, as well as a technical person. So a technical expert that has expertise in doing home sleep apnea testing or all aspects of polysomnography. And we also do have our college staff that is responsible for elements of accreditation, and that may be the management standards, or it may be more specifically the HSAT standards themselves. But we make sure that we have technical experts on our assessment team, as well as physicians that actually perform and interpret polysomnography, as well as our team, members of our staff that are quite familiar with the management standards. So that comprises the assessment team for the accreditation. In terms of the accreditation award, that falls to the DAP committee, and the DAP committee is comprised of 2/3 physicians, 1/3 public members, and on that committee we have a breadth of expertise in that committee with respect to all the diagnostic services that we perform or that we accredit within our accreditation program. Okay, I'm just reading through the list of the questions we go, and 3 of them were the same about multiple facilities. Do we have to register them separately by September 30th? Yes, please register before September 30th. Then you're on our list. You'll be eligible for the provisional accreditation after attestation. There'll be no interruption to your service, provided you can attest to those minimum subset of standards. But if you do not enroll by September 30th, then actually it's going to be more work for you, and there may be a gap in service provision. So please at least register. And as Sharon had stated, there's no obligation for you beyond that point. If you decide you're not going to continue with home sleep apnea testing, there's no obligation that you would have to go through with that afterwards. You would just inform us that you're not going to provide the service any longer. The next question, can you please repeat the 3 steps in providing feedback? So I'm going to call upon Sharon. Can you cover off the 3 steps in providing feedback again?
Okay, so was that the feedback for the standards, I guess?
I am assuming that's what it is.
Okay, do you mind if I defer that to Nav? Who,
Yeah, I think that
Yes,
might
that's
be
fine.
Nav's, actually.
Okay,
Yeah,
Nav, please,
Yeah,
Nav.
no problem. So the guidance that I gave earlier for feedback is, one is during that your use of the online tool and you're providing feedback, the first thing to mention is the rationale for your disagreement. The second point is,
Or your agreement.
Oh, correct. The second point is, what is your desired outcome or the recommendation that you are seeking as a result of your disagreement or agreement? And the last element is, because we are trying to be and focus on being evidence-based accreditation standards, if there is a literature review or a reference document that can support your rationale, please include that. You can do that one of various ways, sometimes a URL or just stating AASM or CTS or CSS. Be as specific as possible. The more information that we have, the better job we can do to evaluate and understand the feedback, so that when we do get our experts around the table to review the accreditation standards and the feedback, we can take the appropriate actions.
Great, thank you, Nav. The next question. Oh, okay, and I will try to answer this, and Woody, I'll probably call on you for any comment as well. It says, since these accreditation standards are meant to address the testing portion of HSAT, that we are not permitted to charge for testing of BC, who or how are we to pay for a medical leader? In terms of the not permitted to charge for this testing, that's correct, because it is an insured service within BC. Although you have not been granted the ability to charge for these services, and it's work that's ongoing with the ministry to look at this particular issue. in terms of how do you pay for your medical leader, it would be a cost that you incur in terms of doing your business. So however you fund any other employee, or if you have contract employees, these contracts would be very similar to the medical leader, and you would negotiate whatever the fee is for the time commitment of these medical leaders. And as I said previously, the amount of time commitment for these medical leaders should be small. It is not a day a week, maybe a day a month. It just depends on whether or not in your organization you have the skill set within yourselves or your staff to take on the actual operations of the roles and responsibility of the medical leader, and the medical leader provides the oversight and signs off and attests to those things being done. All right, what are the qualifications of the medical leader? Another very good question. And my answer to this is that has not been fully defined at this time. What we have to rely on is the BC Medical Quality Initiative provincial credentialing and privileging dictionaries. And within those dictionaries, it actually does speak to the qualifications of a medical director or medical leader of a level 1 polysomnography facility. And that qualification is they must be a respirologist with 6 months of training in polysomnography, or have had a fellowship training in polysomnography. What it doesn't address is for a level 3 facility, because I don't think at that time they envisioned that there would be standalone level 3 HSAT facilities in the province. Where the dictionaries are deficient, then it's up to the DAP committee to fill that gap. And we did bring this to the attention of our DAP committee earlier this week. And in our November meeting of the committee, we will bring this forward with some recommendations. And one of the things that we are looking at in terms of expanding the pool of medical leaders is to expand a medical leader for a level 3 standalone HSAT facility could be any physician that is credentialed to perform polysomnography. So although that doesn't open the gate for a flood of additional individuals, it does open up the pool of potential medical leaders to those physicians that do polysomnography that actually don't meet the very narrow definition of the qualification of being a respirologist or having a fellowship training in sleep medicine. So we do feel that there will be some additional physicians that are would be eligible, and that's a recommendation we'll be taking forward to our committee in November to try and increase that pool of individuals. The next question is, when approximately will we be receiving the attestation to the basic standards? I will answer this, and if I'm not completely correct, then I'm sure Sharon can add to it. So the initial piece here is just the enrollment. Once we have the enrollment, we will send you the application for provisional accreditation. In that application for the provisional accreditation, we will have those standards available to you. Sharon, do you have anything to add?
Yes, just the plan is to have all of the accreditation standards approved by the end of the year, but depending on how many changes we will be making, it may be a bit later than that. But the aim right now is to have all of the standards ready, and once the standards are ready, we can take out the attestation standards, and they will be provided to the facilities along with the initial assessment, as you said.
Okay, and we do have that available to you before the end of February, and so that we anticipate at least 1 to 2 months before that, so we give you enough time to be able to put those in place. Okay. Another question, what is the definition of a facility? Is that each office within our company? If each office is a different address, yes. If it's just a single address, that would likely be a single facility. So it's where you have a address for a location out of which you are doing home sleep apnea testing. Okay, medical director, what qualifications, certifications are required? I think I just covered that. Thank you. Would you be able to further describe what the 10 to 12 attestations are that will be required for provisional accreditation? I think that we have to wait until we get all the feedback from all of you, review that feedback. Depending on the nature of that feedback, take it back to the expert advisory panel and then through to the DAP committee for their approval. And based on that, then we'll be able to move forward with that, what's required for the provisional accreditation. Yeah, and a similar question has been posed next, and I think that once we get that feedback, we'll look to turn that feedback around very quickly so that we can get back to you as soon as possible in terms of those standards for the provisional accreditation. Oh, yes, good question. Is there a standardized referral form being created for HSAT? If so, is that being implemented? And will this promote anti-competitive practices? Woody, do you want to say, just comment on
Sure.
the standardized referral form for us, please? Thank you.
Yes. Hi. So yes, there is a standardized requisition form being developed through the Guidelines and Protocols Advisory Committee, or GPAC as it's known, which is a subcommittee of the Medical Services Commission. That will be provided to all stakeholders for comment before it is implemented. The reason it's being implemented is to help referring practitioners make consistent and appropriate referrals for sleep testing. It will have kind of inclusion and exclusion elements on it, so that it will be hopefully fairly clear for referring practitioners as to the most appropriate referrals. And as I say, that will come out to stakeholders in advance before it is implemented for feedback. And I believe it's getting fairly close. I don't sit on GPAC myself, but I've been kind of monitoring it. And I believe in the month of October, at some point, that will be available for feedback from stakeholders.
Great, thank you, Woody. The other question about will this promote anti-competitive practices? I don't know what those are, but certainly it will standardize. It will standardize identifying which patients are appropriate or not appropriate. The next question: do satellite offices, part-time CPAP clinics within medical clinics need to be assessed and accredited? If that part-time clinic actually is engaged with patients in terms of home sleep apnea testing, providing the equipment, the advice, instructions on how to use it, etc., the answer is yes. Okay, I think we've covered off the training qualifications, the medical director, and how we see that may be changing. And same in the next one, I talked about how we see that changing as well, so that there's a broader group. Who will determine the salary range of the director's position? That's a good question. We will not be. I think that is up to you as the owners, operators of the HSAT facilities. I think that there are lots of examples out there of salary ranges for medical directors that work within health authorities. And you might be able to get that through HEABC. You know, I think that from our perspective as the accrediting body and accrediting your facilities and bringing you under regulation, and we also regulate the physicians who are your medical directors, our expectation would be that the medical directors are being responsible and reasonable in their expectations of your facilities. The compensation is similar to what they would be compensated for the clinical time, for the hours that they actually need to spend doing this work. And I would advise you, if you do have contracts, you specify the hours and specify how they submit those hours, so that you can ensure that it is accurate. But I would expect that they would be reasonable in that and not, if I can use the term, gouge you. And I think that if medical directors or potential medical directors are being extremely unreasonable in terms of what their asks are, so that they're holding hostage these facilities, we at the college would want to know about that. And we would potentially have conversations with those potential medical leaders around it to make sure that they aren't actually trying to hinder the initiative that we're trying to move forward with here. So that's the best answer I can give to that question. Once accredited, will there be a technical billing code to provide testing like there is for other diagnostic services? I do not know the answer to that question. Woody, is that a question you can answer?
I can certainly attempt that. So billing MSP is not just for the technical, it's technical and professional portion. As Dr. Murray indicated earlier, accreditation, at least in British Columbia, is not equal to approval to bill the medical services plan. Frankly, there's a fair amount of work to be done before we can get to that point. And my shop will be undertaking that work. There's regulatory requirements in British Columbia that have to be considered, particularly establishing sufficient medical need and reasonable utilization of existing facilities. We're gonna have to do a fair amount of analysis for the Medical Services Commission on possible impacts to the available amount. And we're gonna have to work closely with the BCR SPCA to get the data to undertake that work. My understanding is in Alberta, which has been going down the accreditation road for a couple of years, facilities there are not charging patients and they're not billing the provincial plan. I understand there's been no loss of facilities in Alberta from the work that's been undertaken. So I do believe this is a step-by-step process, and we are going to look at the MSP question. It's not going to be done overnight, but at this point, that's really about all I can say about that. I'm very aware of the challenges and the issues to be resolved.
Thank you, Woody. I do like this next question. Actually, I've liked all the questions, but this question: when it comes to site assessments for the facilities next year, there will be an influx of facilities to be assessed in this province. How will it be determined by the DAP? Which facilities will be completed first, and so forth? So I do like this question because I think it recognizes that we are going to have a lot of work to do in the DAP as well. So thank you for that. How will it be determined? We will try and develop some criteria. And certainly one of the thoughts that we had for an organization that has multiple facilities, what we might do is do one of those organizations within one of those facilities in an organization. And if they do well and they have the same set of policies, procedures, et cetera, and all the others, then we might be able to put them towards the end of the list. So that helps us in ensuring that multiple facilities under one organization, if they can do it well for one, maybe they can do it well for the other. That does not mean you get out of jail and we aren't going to go to each one of those facilities. We will eventually, we just might put the rest of them later in the list. But we will schedule them over the period of 2 years and then the on-site assessments over a period of 3 years. We will not get to everyone in the first year. And that's why it's very important that we have the medical director attest that you meet the standards. Okay, can you explain the subset of standards that will come into effect October 1, 2020? No, none of the standards will come to effect until February 28th, 2021, or February 2021. It is during the time between your enrollment and that you apply for the provisional accreditation that you'll have to attest to those standards. So they actually come into play when you write to us and attest that you meet those standards. Then we hold you accountable that you actually do meet those standards. The next question, will level 1 facilities still be able to charge for HSAT even though we are not? I think that the level 1 facilities that want to charge for HSAT have to get approval through the Medical Services Commission to do that. Those that have will continue to do so. Those that have not would have to apply. And is there a moratorium on that currently, Woody, or do you know?
There's a moratorium on applications for polysomnography level 1 facilities. And I can share with you that it was just approved yesterday, and I've just been informed today that that moratorium has been extended for 2 years. And I see another question about, will CPAP companies be able to apply for level 1 facilities? Anyone can apply for a level 1 facility when the moratorium is removed, as long as the applications are assessed by the Advisory Committee on Diagnostic Facilities. And I'm happy to address any of these MSP and approval to bill MSP questions separately. We may run out of time here. I think most of the folks on this call probably have my email address. I'm happy to get into it into more detail, but at this time I can say that our policy is such that to be approved to bill MSP for level 3 studies at this time, and policies do change, but at this time the policy is you must provide for a minimum of 3 beds suitable for overnight polysomnography. And as I say, the moratorium has just been extended.
Thank you, Woody. And you are correct. We will not get through the additional 39 questions that have come up. And I've not been able to keep up with the number of them that are coming in. And so our commitment to you is that we will answer those 40 additional ones that we don't get to in the next 2 minutes. And what I can do is those ones that have to do with the MSP issue and billing, I can forward to Woody to answer for us, and we could post those as well on our website if that is okay with Woody.
Absolutely.
Okay, thank you. I'm just going to cover this last question that we do have time for, and that is, can a medical leader also be an interpreting physician? Absolutely, yes, they can. And there may be some HSAT facilities where they only have one interpreting physician, and that interpreting physician is also the medical leader, and that medical leader is responsible for the credentialing and privileging of themselves. However, we do have a mechanism for oversight of the credentialing and privileging of all physicians that are interpreting physicians. And in fact, in order to be an interpreting physician, you do have to fill out the credentialing and privileging form that the DAP has. So that in general, anyone that would interpret these for you that's eligible is likely already been credentialed, because they are likely doing it for another facility and are able to bill MSP for the other facilities for doing polysomnography. And what I'm going to do is I'm going to stop there. I do apologize if I have not gotten to all of the questions today, and I suspected that we would not. But as I said, we are committed to answering your questions, and we will go through the additional 44 that are listed here and answer them and post them to our website. So I'd like to thank you all for joining. I think at one time we had 65 participants, so it shows that there is a significant interest. I would once again encourage you to enroll by the end of the month, and that just keeps your options open much longer. And I'd also like to thank the DAP team for participating here today. As well, if you have any other questions that you have not been able to add to our chat function here, please email them to dap@cpsbc.ca. If you want more information around this, if you go to the website that's listed on this slide, and I do believe that's where we will post the answer to these questions as well. So on that note, I'd like to thank you all for participating. Please don't hesitate to contact us and ask us any of the questions that you may have. So have a good evening. Bye now.
Thank you.